My name is Gretchen. I'm so happy to be here today. I want to first thank Jeanette for inviting me here, and I want to thank Dawn also for making this day possible. So I'm here to talk a little bit about what we're doing on the ground in New York City around obesity prevention and control. First, I'm going to start out, and Marlene mentioned starting with the data, and that's what we do too when we really try to inform our agenda. So I'm going to give an overview of New York City. So this is a map of New York. On the top is the Bronx, and that red area is the South Bronx. Then you have Manhattan in the middle. The red area is pretty much Harlem, East and Central Harlem on the far right. To the right is Queens. Down below is Brooklyn. The red area is North and Central Brooklyn, which includes Bed-Stuy and Bushwick. And then we have Staten Island. And so those red areas are areas that we typically refer to as our high-need neighborhoods: South Bronx, East and Central Harlem, North and Central Brooklyn. We have district public health office neighborhoods there. They help inform our health equity approach. We have many neighborhoods in New York City on this map. You'll see about 42. Some people say there are 188 neighborhoods in New York City, so it really is diverse and has different cultures in each of those neighborhoods. We're also very ethnically diverse. About 35% of the population is white, about a quarter are Hispanic, a quarter are black, and over a third of New Yorkers are actually foreign-born. So while many people from New York City or in New York City are born in other places and then migrate to New York City, they're actually a whole third of the population weren't born in the United States. About 1 in 5 New Yorkers lives in poverty, and 1.8 million receive food stamps or supplemental nutrition assistance program dollars. So this really informs how we think about what we need to do in New York City. And I'm just going to show one map on the health condition that we're talking about today, and that's obesity. And I just wanted to point out that you can see that the areas that are red are pretty much consistent with those high-need areas. So the highest level of obesity, which sometimes goes up to 42%, is in those same neighborhoods. When you look at obesity and overweight together, you can see in those neighborhoods about 70% of the population can be obese. And that's where you're going to find a lot of the SNAP residents, you're going to find a lot of poverty, you're going to find your Black and Latino populations typically. So when we think about addressing obesity in New York City and health in general, we have a multi-pronged approach which really is encapsulated in our policy called Take Care New York. We're really working through to our Take Care New York 2012 goals right now. And so the approach is to make citywide policies, and those are things like our menu labeling regulation, the SNAP proposal that we put down to USDA a couple years ago, the sugar, sweet, and beverage tax that's been proposed and rejected on a number of different occasions, and the most recent news about our portion size policy, which is really to cap the size of sugary drinks at food service establishments to 16 ounces. That does not include dairy drinks. And then we have system and sector-based interventions, and those are interventions around things like food procurement for city agencies, things that we have going on in the school settings, things that we have going on through primary care practices, and a number of different other types of settings. So thinking about that socio-ecological model that we saw in the previous presentations, thinking about that level that's changing the context around settings. And then we also have neighborhood-based approaches, and those are typically in those high-need neighborhoods that I pointed out, but they really are adapted to the exact population that's suffering from a condition. So sometimes we are going to branch beyond those high-need neighborhoods to other high-need neighborhoods defined by condition. For example, when we think about smoking in New York City, we need to be focusing on Coney Island sometimes and the Russian population there, which has a really high prevalence of smoking, or East, the Alphabet City in the south part of Manhattan, on the far east. There are also very high levels of smoking there, and there's a high prevalence of smoking among the Chinese population there. So we really try to organize our work around high-impact evidence-based interventions. So I'm just going to tell you a little bit about a few of the interventions that we've worked on at the health department, and we have a number of different interventions in addition to these and complemented by these, but these are just some examples. So we have these food standards that we developed about 4 years ago to govern how we purchase and serve meals in city agencies, and also what can go into vending machines that serve beverages in city agencies. We recently updated those with food vending standards in December. We chose this approach because we have over 200, and now it's up to 290 million meals and snacks that we serve every year through our New York City agencies. The largest that you may have heard of is the Department of Education. We serve 800,000 meals and snacks a day. It's the second largest food service system in the United States after the US military. So we have a lot of chance to have impact there, and all we really need to do is just change the way we buy and prepare and serve things. So it's a very low-cost intervention in reaching, lots and lots of people. We have about 1.1 million children in our school system. So what we do to do this is we invite in our stakeholders to activate the process. We, of course, brought in and developed the policies, the actual standards themselves. We provide technical assistance through registered dietitians on actually implementing these standards. And then we work to integrate these standards into contracts. It's getting down into the real nitty-gritty of the contract language that says what you can and cannot do when you make these transactions. Also working with, in a systems approach, we have a program called Move to Improve. And this is a program that is based on the fact that in New York State, we have a policy on the books that says kids are supposed to be getting 120 minutes of physical education every week. But many schools don't even come close to reaching that. There are a number of different barriers. One of them is just that schools often do not have gym space. So what we do is we say, okay, you don't even need a gym. We're gonna go to the teachers in the classroom, we're going to teach them how to lead physical education, and then they're going to lead it in 10-minute increments. And so we know that through the evaluations that we've done of this, that this is increasing a little bit, the physical education and physical activity time for those children. And so far, we've trained about 5,000 staff in 500 schools, and that impacts about 200,000 students. We focus mostly on K through 3 so far, although we have done some training in curriculum development for 4th and 5th grade students, but it is going to be harder, and it is a little bit harder in those grades because that's when testing starts. So that really gets into when Jeanette said you really need to focus on achievement and on health at the same time. That's true. We do have some evidence to show that those things are linked, but we really need to build the evidence around that too and show that when you do have kids be active in the classroom, you are going to increase their scores, but we really need to move in that direction and develop more evidence around that. And thinking about the physical activity in general, we also have something that we've developed called active design guidelines, and this really approaches the entire city. It's the entire municipality of New York City. They're called active design guidelines, and they lay out how we can create the built environment so that it supports physical activity. And this includes things like the whole New York City agenda around the built environment includes things like bike lanes, park access, and these specifically focus on doing a lot of things so you can increase access to stairs and other types of things in buildings to increase physical activity. We're a very vertical environment, and there are these things called stairs that are closed off to many people because they're locked or people can't find them. And so we're just simply doing something very cheap by placing stair prompts at elevators and stairwells and saying, here's an opportunity to burn calories, not electricity, take the stairs. And we do know that when these are provided, they do increase people's physical activity levels, or people are more likely to take the stairs. And then finally, I just want to touch on what we're doing around food retail. And the reason we're working on food retail is that we're working to eliminate the food deserts in New York City. So this work is really focused in our high-need neighborhoods. In total, we have about 2.7 million people living in those neighborhoods. And we do this through a number of different strategies. We work with bodegas to help them become more compliant with the WIC policies and to develop strategies around making sure that they have the things that are approved in the WIC package, like low-fat milk, leafy greens, whole grains, and those types of things. Through the Communities Putting Prevention to Work project, which was mentioned before, we worked with grocery stores in the produce section to help them better purchase, merchandise, and sell produce in their produce sections. We also have fruit and vegetable stands in our food desert neighborhoods called green carts. And we work with farmers markets to help ensure that food stamps can be used there. And we've talked to farmers at some of the farmers markets there, and some of them report that as much as between WIC and health bucks, as much as 40% of their business comes from these types of sales. So we really know that this can be impactful and really good for us. It can be in terms of people who care about health, for the people in the neighborhoods, but also for the small farmers in the region who come and supply these the food in the farmers markets. And then finally, I want to talk about what we do to change norms and change how people think about these issues in New York City. And I'm going to talk a little bit about our media campaigns. The one that we've spent the most time developing is called Pouring on the Pounds. It's our counter-advertising for sugary drinks. And the goal is to raise awareness that sugary drinks are not healthy for people and to show that the consequences of them. Several years ago, sugary drinks weren't necessarily on the map for most consumers, and it's really taken a lot to make people aware that this is a concern. This is a summary of the campaigns that we've done. So in August 2010, we had a very small, actually, in August 2009, it's not on this timeline, but in August 2009, we released a video called Man Drinking Fat, which I'm going to show you in a minute. And then we followed it up in August 2010 with the Subway campaign. We complemented that campaign with a YouTube video that's actually now being run in New York City and in many other municipalities as part of a Communities Putting Prevention to Work initiative. We had a campaign in January of 2011 we call it Big Sugar Number One. It's a very hard-hitting campaign that talks about the health consequences of obesity, of sugary drink consumption. We followed it up with something similar in 2011 in the fall. And we also have social media. So that's sort of in a nutshell what we have. And I just want to talk through the concepts here. So the first campaign we did is called Man Drinking Fat. And the idea here was just to link sugary drinks with obesity. And here's what we did. So that was Man Drinking Fat, and I just wanted to point out that that was the point there was to connect sugary drinks with obesity. But when we stepped back from that, people were saying, well, how does, basically they're asking what's the mediating factor, like why do sugary drinks lead to obesity? And we realized that we needed to articulate that it was the sugar. And so that's what we did next. We did a campaign where we developed, see all those sugar packets? That's just demonstrating how many sugar packets go into common serving sizes of sugary drinks. And we also did another thing with this campaign. When we tested messaging around this, people said they didn't like the word fat in those campaigns. So we changed that. And that really does put people off. And it makes, especially when we start thinking about children, people do find that it could be, certain people find that it could be stigmatizing. So we eliminated that and we changed our tagline. So you'll see that in this campaign. This is what complemented the Subway campaign. So that's Damien, by the way, and he did have a spittoon underneath the thing. So he's been with us for a while. So so then we turned to a more hard-hitting approach, and we decided that we wanted to not only show the sugar packets leading to obesity, but we also wanted to show what would happen just in a day, because we had done some research that found that on average in some neighborhoods, people were drinking as many as 4 sugary drinks a day. So we developed a campaign that was really hard-hitting for the television, and we complemented it by a Subway campaign where we showed the sugar packets in a number of common sugary drinks and then showed the combinations to show how it could add up in a day. So the tagline here is, or the message here is, you're drinking 85 packets of sugar in just 4 sugary drinks a day. So it's very much based on the evidence that we found and what was happening.
Does this sound familiar? You grab a mid-morning soda, a sweetened tea at lunch, a frozen coffee drink in the afternoon, and a couple of sodas at dinner. Seems harmless enough, but that many sugary drinks a day can add up to a lot of extra sugar. And all that sugar can bring on serious health problems, including obesity, which causes type 2 diabetes, heart disease, and even some cancers. So don't drink yourself sick. Go with water, seltzer, fat-free milk, or unsweetened teas instead.
So that one's, not as fun, but we do know from the evaluations of it that we've done that half the people who saw it say they're drinking fewer sugary drinks. So that's something that's, that we're pleased with. We launched the follow-up campaign to this in October of 2011 in conjunction with Food Day, which was the first Food Day was last October, and we call it Big Sugar Number 2. And we showed basically how this adds up over a year. So when you drink this many sugary drinks a day, what that adds up to a year. And we also complemented by a different way of quantifying the sugary drinks. And so we took maps of a number of different places in New York City, and we just showed how many miles you'd have to walk to burn off a common drink. So this says you'd have to walk the 3 miles from Union Square to Brooklyn to burn off the calories from one 20-ounce soda. It's a long walk.
Sugary drinks may seem perfectly harmless, but sugary drinks are a big reason for the obesity epidemic in America. Obesity causes type 2 diabetes and its serious complications like heart disease, blindness, and even amputations. If your kids drink 1 bottle of soda a day, they're eating 50 pounds of sugar a year. 50 pounds of sugar from just 1 soda a day. So don't drink yourself sick. Go with water, seltzer, fat-free milk, or unsweetened teas instead.
Okay, so that was what was on television, and then this is what we put on YouTube. It's Damien again. So we tried to work through a number of different strategies. And that was something that we put on, as I mentioned, that was on YouTube. We also linked to all of this information on our Facebook page. Just want to briefly touch on a couple of different other campaigns that we did because I'm running out of time. And this is the one that we did around portion size that was launched in January and really was also very hard hitting. We got a lot of earned media from this. This one actually had 145 earned media mentions, which is basically newspaper and other kind of articles written about it, and almost 500 million unique visitors per month to websites about this campaign. So that's all around the world. And then the Pouring on the Pounds campaign has also generated a lot of buzz as well. So that's it, and thank you very much.
I know we're late. We started a little late, so we're gonna take just maybe 5 or 10 minutes for a few questions. If I can get the 4 panelists up, and we'll jump right in, and then we'll get you all to lunch. So anybody wanna? Go ahead. And a quick introduction.
Hi, good day. I have an 8-month-old grandson, and I was visiting with him yesterday. And I was feeding him. I was taking care of him for the day, and I wasn't quite sure. I just kind of fed him what I thought was lunch, and then what was dinner. And then my daughter came home later on, and I said, "By the way, do you know how many calories your son is supposed to take in?" And here she is, a physician, and she said, "No, actually, I don't." So I started to think that might be, a good starting point, just letting women know how many calories their baby should be consuming.
Sounds like a good next step. Raphael, do you want to add anything, or? Okay, moving on. Yes, we'll take it.
Have you seen opposition from Coca-Cola and some of the larger companies that produce sugar-based products that you're going against?
Absolutely. So we absolutely have a lot of opposition from those organizations, and the American Beverage Association has opened its first satellite local office in New York City. And there's a lot of advertising dollars spent. There are a lot of lobbying dollars spent by that industry, and the thing that we know is that the evidence is on our side, and something that is going to be something that we face moving forward. It's very, very similar to what happened with tobacco, so it's to be expected.
Sean Lucan again from the Bronx. So really excellent work from all the panelists. So genetic imprinting and transgenerational transmission of obesity is so interesting, and I'm such a huge fan of the work of the New York City Health Department and the Rudd Center. So one thing I just wanted to comment on the video from the walking and also the Rudd Center presentation, just in terms of the calories to burn off the sugar. So one thing that the beverage companies and the cereal companies probably know that they're not saying is that sugar consumption begets sugar consumption. So you're really kind of underestimating the caloric impact of the overconsumption of that single bowl of cereal or that single beverage because, if you're drinking that sugar that's, having all kinds of ramifications on hormonal axes in the body and drives your intake up. And so your total daily consumption, the ramifications for total daily consumption probably exceeds, the excess calories just from that single beverage. So it's probably the case that single beverage, you'd have to walk more than 3 miles. You'd probably have to walk from, to New Jersey maybe. But it'd be really interesting, so in terms of the Rudd Center, I'd like to look at, so not just the differential calories for that single serving, but the total daily calories for the day. And I'll bet that the kids that are eating the sugar-sweetened cereal are actually taking in more total daily calories as a consequence of that.
Right, yeah, well, it's interesting you bring that up. One of the new initiatives that we're sorry, people hear me? One of the new initiatives that we're starting is actually looking at food and addiction. And Kelly Brownell has an edited book that'll be coming out this fall on that topic, where he really reviews all of the science from, the really basic animal studies all the way through policy, a lot of psychology studies in there as well, to really show the building evidence that sugar in particular seems to trigger an addictive process, which really goes to what you're saying, that it's not just that one soda, but that it's really hard for people to self-regulate that substance.
And Phil, I want to turn to you because we were talking at dinner last night. You mentioned, in a sense, the hidden costs of sugar, the accumulated calories, and we were talking at dinner last night about the hidden costs and the true costs of food over time. Do you want to mention that?
Yes, I'll come back to that. Before I do, I wanted to come back to the calorie question. I didn't jump in fast enough. I think it's very hard to predict what the caloric needs are of anybody. I mean, I don't think any of us regulate our own intake in terms of calories. And I think the strategy that we ought to be pursuing is what kinds of foods are likely to regulate satiety. So fruits and vegetables, a good source of protein. The elimination of sugar drinks, because sugar drinks aren't compensated for. If you have 100 calories of orange juice versus 100 calories of an orange, you compensate for the orange, but you don't compensate for the juice. So I think structuring a diet that way rather than being prescriptive about calories is a lot easier. One of the things that strategically we've thought about at CDC was how to shed some light on the agricultural production system. And because we don't pay the true costs of food. We don't pay for the environmental contamination that concentrated animal feeding operations produce in terms of water contamination and air contamination. We don't pay for the antibiotic-resistant infections that are a consequence of the 70% of antibiotic production that's used on those same controlled animal feeding operations. So one of the areas for, if there are any philanthropists in the room, is that the IOM, we held a workshop on the true costs of meat in April, and the IOM is now looking for support to do a consensus study on the true cost of food, because I think that would help us transform the perspective on the agricultural production system, which has all sorts of hidden costs that none of us are paying.
Let me take maybe one more question, and then we'll break for lunch, and our guests will still be here, and we can continue the conversation over lunch.
Gretchen, great presentation.
Oh, thank you.
What about an increase in artificially sweetened sodas? Are you finding that?
Well, what we're following and we're doing surveillance on in New York City is consumption of sugary drinks more so, but what we advocate for is consumption of tap water, seltzer, unsweetened teas, and low-fat milk.
I should mention that Gretchen also, in addition to her PhD in epidemiology from Yale School of Public Health, has a master's degree in communications, which obviously you are putting to great use.
Jeanette, can I add
Of
one?
course.
Yeah, very quickly, because the energy density issue has come up. We just published the systematic review that came out from the 2010 Dietary Guidelines Advisory Committee on energy density and weight control in children, youth, and adults, and it works. But you have it right. The issue is not to focus on the energy density of individual foods, but on the energy density of the overall diet.
So why don't we just take a moment, I'll start with Marlene and then work our way back, and just kind of, last word, so to speak, particularly to this audience of alumni from the Yale School of Public Health and our guests.
I mean, I guess I would just say we need more advocates. We need passion. We need people to really speak up when they feel like food companies are doing things that are deceptive. So don't hesitate to contact them.
I would echo that, and I would say, don't forget the letter to the editor. That's something that's great to do. So be vocal and be active in any way that you can.
The problem of obesity starts even before life begins.
But not before the life of the mother.
Good clarification.
Right. I think that there's a real opportunity here to join public health and clinical medicine again. That hasn't been true for 100 years, but now that opportunity exists and is essential if we're going to solve this epidemic.
And I'll just close by, of course, thanking this fantastic panel and all of you, and saying that in addition to combining public health and clinical medicine, that we really need to think about breaking down all of the silos in terms of the approaches that really all of our speakers spoke about, and that is to really think about an ecological approach that brings together perspectives from the individual through public health and up through public policy, media, and communication, and that we need to think beyond, really outside of all of our boxes, and working together we can hope to make an impact. So keep up the good work. We look forward to our continued collaboration and to, I'm sure, what will be a very healthy lunch. So, thank you.
So that's